Hi everyone, it's me, Melanie, your IVF nurse. Today's topic is going to be about beta HCG results. So whether you're doing them in clinic or at an outside lab, most clinics will have certain criteria for when you're doing your beta. So depending on if you're doing a timed intercourse cycle or an insemination cycle, you want to follow your clinic instructions as per when you should be doing your test. If you're doing an IVF cycle with a fresh transfer, your beta HCG date will be dependent on the day of transfer. So if your clinic is offering day 3 transfers, then you will be doing your beta HCG usually 14 days from the date of transfer. If you're doing a day 5 transfer, so blastocyst, then you're probably looking at about 12 days post-transfer to be able to do your beta HCG. Now, if you're doing a frozen embryo transfer, then you want to follow your clinic instructions. Same thing, a lot of clinics nowadays are transferring in blastocysts, so that usually can be tested as early as 12 days, but some clinics will still want you to test on day 14 post-transfer. Now, I know a lot of you out there probably do test even earlier. I've seen some things on some of the boards that people are testing maybe 5 days post-transfer. Now, if you've done a frozen transfer and you've either done a natural cycle or a medicated cycle using estrase, then you could be testing that early. However, if you have a negative response, you're still going to have to do your test on that specified date by your clinic. If you should have what you think is your period before you more or less call it quits and stop your meds, do check with your clinic to see what they recommend. Now, if you've done a frozen transfer where you've done low dose gonadotropins, or if you have done a fresh IVF cycle and you've had to be triggered, so the use of HCG or Ovidril, that will give you a false positive because it can take your body up to 10 days to metabolize and get that out of your system. So you don't want to be testing early when you've been doing a medicated cycle with low dose gonadotropins, or an IVF cycle when you've been triggered with HCG or Ovidril. Because that will just give you a false positive potentially, or hopefully a positive, but you still want to do that test date as per your clinic instructions. Now, in terms of beta HCG values, so with the timed intercourse cycle and insemination cycle, it's about the same thing, where we're looking to see clinically a beta HCG level above, say, 50. That doesn't mean that if your beta is 30 that it's not progressing or where it should be, because every pregnancy is different. However, clinically we like to see it above 50. So your clinic may have you repeat the blood test. They may have you do several repeats, maybe every other day, until it reaches a certain value. So depending on that initial result, you do want to check with your clinic to see when your follow-up beta will be, if it's required. Now, for those of you that have done IVF with either a fresh transfer or a frozen embryo transfer, your betas, we're looking in terms of seeing levels above 100. Now, these can range from, I've seen them as high as 5,000 initially, and I've also seen them as low as, say, 26, even 14. Now, usually when you're doing IVF or an FET, if your beta is really, really low, they're going to want to continue to monitor it to see if it's a chemical pregnancy. But if it's over 100, your clinic may or may not have you repeat it. Some clinics will say, no, just book your prenatal ultrasound in 3 weeks. Some will want you to repeat it at least once in 48 hours, and some clinics may say, you know what, let's just continue to monitor your blood tests until we get to a particular level, then we'll have you book your prenatal ultrasound. So each clinic is a little bit differently, but those are the guidelines in terms of what we like to see for beta HCG initial results. Now, negative test results, those absolutely suck. And I can tell you from a nursing perspective, it is probably the worst phone call that we as nurses have to make, especially if you've got a really good rapport with a patient. But across the board, when nurses are notifying patients of negative test results. It's not that anybody is fighting to give that news. It really sucks to give that news to anybody, because we do know as healthcare providers how much you have invested in that cycle, the time, the commitment, the finances, the emotions. So we totally do get that the news is devastating, and a lot of the times when we're calling with a negative beta, the only thing that you're hearing, and this goes for a positive beta as well, is yes, it's positive, or no, it's negative. And then the instructions after that kind of all get blurred, either in excitement because the test is positive, or in disappointment because the result came back negative. So you do want to either ask your nurse that is relaying the results to you to either send your instructions in an email, or to repeat the instructions back to her, so that you, or him, so that you are understanding what your next step is and what the clinic expects you to do depending on your result. Now, with a negative beta, there are many times when you may just say, you know what, we're gonna go again. And then there might be times where you don't know what to do. You're devastated, or you're pretty much at the end of what you can take, and you're really not quite sure what the next step would be, if you even want to move forward with anything else. Usually in that case, it's always recommended that you do see the doctor, just to see what recommendations they do make. The other thing is that if you think that you haven't done everything for your cycle, then the other option would be for you to contact me. I do offer coaching services and can review your information in terms of your testing, your cycles, and possibly advise you to next steps that you may want to discuss with your doctor in advance. So there are many different things that may be, as a patient going through the first time, it might be your first cycle of IVF, and usually things are all done kind of like in a sequence of a ladder, so you're not going to start off with the whole kit and caboodle right from the start. Usually if it's unexplained and everything looks good on paper and you should be getting pregnant, then the doctor may choose to do a lower dose gonadotropin, and just your trigger medication could possibly be with Bhcg. Dosing may need to be changed. If it's a failed frozen embryo transfer, then there's different things you could be looking at, such as endometrial receptivity. You could be doing things like immune testing. Just there's a few things out there that, if it is your first go around with a frozen transfer, or even a second or third attempt at a frozen transfer, and you're still not successful, then there are options out there for those of you who are still relatively new and haven't gone through ERA biopsies and immune testing, and some of the more advanced stuff that is offered at some of the clinics. Now, do keep in mind that these next steps, they do have a hefty price tag that comes along with them, and the clinic should be, if they're discussing with you moving forward with this, they should be also informing you of any costs related to these tests or procedures. If you have any questions, please feel free to email me at yourivfnurse@gmail.com. If you'd like, please check out my webpage, www.yourivfnurse.com. And if you like my YouTube videos, then you can subscribe, or you can leave me comments down below. Thanks for watching. To my city, every girl I know used to walk around with a slouch, had a mattress on the floor. Now my